Have you ever woken up confused, maybe even a little worried about something that happened while you were asleep? Maybe you've wondered what it means or if something's wrong with you. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon. And if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're going to talk about something that affects many people but rarely gets discussed openly: nocturnal emissions, also known as wet dreams or nightfall. And I want you to know right from the start, this is completely normal, nothing to be ashamed of, and absolutely not harmful to your health. If you're new here, welcome. I create content every week about urologic health, bladder health, sexual health, and so much more. If you find this helpful, please subscribe and share this channel with your friends. Let's dive in. What are nocturnal emissions? The medical term for wet dreams is nocturnal penile emissions, but most people simply call them wet dreams or nightfall. In the simplest terms, it's when you ejaculate during sleep and wake up to find a bit of a mess in your sheets. And here's something important. This can happen to both men and women. Yes, women can experience nocturnal orgasms and release of fluid during sleep as well. But because this topic is so rarely discussed, many people go through it alone, confused, and sometimes embarrassed. I want to change that today. How does ejaculation happen? To understand why nocturnal emissions occur, let's first talk about what happens in your body during ejaculation. Usually, ejaculation is triggered by sexual stimulation or friction. Your body sends signals to your sympathetic nervous system. That's the part of your nervous system that gets activated during stress or excitement, like a fight or flight response. Your adrenaline is rushing, and that's what causes the sympathetic nervous system to fire. This sends signals down to your spinal cord, which then triggers the bladder neck to close. That's important because it prevents the ejaculate from going backward into the bladder. Instead, it moves forward, out through the urethra. At the same time, fluid is released from the seminal vesicles through the ejaculatory duct, structures I've talked about in other videos, so feel free to check those out for more detail. When that fluid enters the upper part of the urethra, it creates a reflex. This reflex sends another signal to a different part of the spinal cord, which causes the pelvic floor muscles and the muscles around the urethra to contract rhythmically. That's what pushes the fluid out. So, ejaculation is a complex, coordinated process involving your nervous system, muscles, and reflexes, and it can happen even when you're asleep. Who experiences wet dreams? According to small but meaningful studies, about 80 to 90% of men experience at least one nocturnal emission in their lifetime. For women, the number is around 30 to 40%, though research in this area is still quite limited. Most people experience their first wet dream during puberty, which makes sense. That's when hormone levels are surging, and the body is learning how to regulate sexual function. But here's something that might surprise you. Nocturnal emissions can happen throughout your entire life, not just in your teenage years. In fact, research shows that if you haven't ejaculated in a few weeks, you're more likely to have a nocturnal emission. Your body has its own way of managing sexual function and fluid buildup, and sometimes that means releasing during sleep. Interestingly, about 48% of men who experience wet dreams during puberty have no idea what's happening, and never talk to anyone about it. Imagine waking up as a young boy, finding a sticky mess in your bed, and not knowing if you wet yourself or what just occurred. That can be confusing, even frightening, and the silence around it only makes it worse. That's why I'm talking about this today. You're not alone, and there's nothing wrong with you. Do you have to be having an erotic dream? Here's a common misconception. People assume that wet dreams only happen when you're having a sexy or erotic dream, but that's not always the case. When researchers studied this, they found that up to 40% of men who experienced nocturnal emissions were either having a completely non-sexual dream, like dreaming about something mundane, or couldn't even remember the dream at all when they woke up. So, you don't have to be dreaming about anything sexual. Sometimes, it's simply your body's way of releasing built-up tension or fluid. It could be triggered by friction if you're sleeping on your stomach, or it could just be a natural reflex that happens during certain stages of sleep. Is it harmful? Should you be worried? Let me say this clearly. Having nocturnal emissions is not detrimental to you in any way. It will not affect your overall health. It will not harm your sexual health. It will not impact your fertility. It will not weaken you, drain your energy, or cause any long-term problems. This is one of those topics where myths and misinformation have caused unnecessary fear. Some cultures or belief systems have attached shame to wet dreams, suggesting they represent a loss of vitality or self-control. But from a medical standpoint, that's simply not true. Nocturnal emissions are a normal, healthy part of how your body regulates itself. Whether you've had one, many, or none at all, you're completely normal. Why does this happen? Nocturnal emissions are influenced by several factors. Age, they're most common during puberty, but they can happen at any age. Frequency of ejaculation. If you haven't ejaculated in a while, your body may release during sleep. Hormone levels. Testosterone and other hormones play a role in sexual function and can influence the likelihood of nocturnal emissions. Sleep stages. Certain stages of sleep, particularly REM sleep, are associated with increased blood flow to the genitals and natural arousal responses. Your body is incredibly intelligent. It knows how to manage itself, even when you're not consciously involved. Nocturnal emissions are simply one way your body maintains balance. What should you do if this happens? Nothing special. Truly. If you wake up and realize you've had a nocturnal emission, just clean up and go about your day. There's no need to feel embarrassed, worried, or ashamed. If you're a parent and your child experiences this, please approach the conversation with warmth and reassurance. Let them know it's normal, it's healthy, and it's nothing to be ashamed of. That simple conversation can prevent years of unnecessary confusion or anxiety. And if you're someone who has never experienced a wet dream, that's also completely normal. Not everyone does, and that doesn't mean anything is wrong with you either. I made this video for one simple reason, to reassure you. Nocturnal emissions are a natural part of human biology. They're not a sign of weakness, they're not harmful, and they're not something you need to fix or worry about. Your body knows what it's doing, and whether you've had one wet dream, many, or none at all, you're exactly as you should be. If you ever have questions or concerns about your urological health, please don't hesitate to reach out to a healthcare provider. We're here to help you understand your body without judgment, fear, or shame. Thank you so much for watching. If you found this helpful, please subscribe and share this video with anyone who might benefit from it. And as always, remember to take care of yourself because you're worth it.